When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite, obey your thirst.
Every Who down in Who Newville liked the holidays a ton. But where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one Who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 pediatrics questions. Just a reminder that you can find these questions and a lot more at medprep2go.com. If you'd like to get involved with this project, please email me at ted.medprep2go@gmail.com. And if you like what we're doing here, please let your friends know about it and consider giving us a review because all of that helps. All right, the first question. A 6-month-old boy and his parents present to the pediatrician for routine evaluation. The boy's father notes that the veins on his son's head have become increasingly prominent over the last 2 months. The patient has also been more irritable than normal over the same time period. The patient was born at full term, has not had any health complications to date, and is up to date on his vaccines. Physical examination is significant for a bulging anterior fontanelle and paresis of upward gaze of both eyes, making the eyes appear to be driven downward. Review of the boy's growth charts indicates a head circumference at the 85th percentile, up from 40th percentile 2 months ago. Which of the following is the most appropriate next step in evaluation of this patient? A. Computed tomography of the head. B. Lumbar puncture. C. Thyroid stimulating hormone level. D. Ultrasonography of the head. Or E. Vitamin D level. The correct answer is D. Ultrasonography of the head. Rapidly increasing head circumference should raise suspicion for hydrocephalus, which is the accumulation of cerebrospinal fluid, or CSF, due to abnormal reabsorption in communicating hydrocephalus, or obstruction of flow in non-communicating hydrocephalus. Ultrasound or ultrafast MRI is a preferred initial imaging method as they avoid unnecessary radiation. In addition to increasing head circumference, hydrocephalus can present with a setting sun phenomenon of the eyes due to upward gaze paresis. Cushing's triad, which is hypertension, bradycardia, and irregular respirations, may also be present. Answer choice A, computed tomography of the head, is incorrect. CT of the head would be appropriate in the acute setting of hemorrhage or trauma. This child's presentation is not acute, so unnecessary radiation exposure should be avoided. Answer choice B, lumbar puncture, is incorrect. Although meningitis can result in a bulging fontanelle, the child would more likely present acutely with fever, vomiting, and/or seizures. Recall that if bacterial meningitis is suspected, treatment with vancomycin, ceftriaxone, and dexamethasone should be initiated without delay. Answer choice C, thyroid stimulating hormone level, is incorrect. Although hypothyroidism can result in large fontanelles, this is most often picked up on newborn screens, with symptoms of lethargy, constipation, hypotonia, and hypothermia developing by 2 weeks. Answer choice E, vitamin D level, is incorrect. Vitamin D deficiency can cause delayed fontanelle closure, as well as wrist and ankle widening, genu varum or genu valgum, and frontal bossing. However, this child's rapid increase in head circumference raises suspicion for other etiologies. The key learning point here: rapidly increasing head circumference should raise suspicion for hydrocephalus and should prompt imaging with minimal radiation exposure, including ultrasound or MRI. Question 2. A 10-minute-old girl is evaluated in the neonatal intensive care unit for respiratory distress, which has been present since birth. She was born at 40 weeks gestation via cesarean section for breech positioning. Amniotic fluid was clear. Vital signs are significant for a normal temperature, respirations of 60 per minute, and oxygen saturation of 82% in the right upper extremity. On physical examination, auscultation of the chest is positive for bowel sounds. Which of the following is the most likely cause of this patient's respiratory distress? A. Inadequate amniotic fluid clearance. B. Infection. C. Lung hypoplasia. D. Surfactant inactivation. Or E. Surfactant insufficiency. The correct answer is C. Lung hypoplasia. The presence of bowel sounds in the chest is suggestive of congenital diaphragmatic hernia. Invasion of bowel into the thoracic cage results in pulmonary hypoplasia and resulting respiratory distress at birth. Chest X-ray would show loops of air-filled bowel in the thoracic cage. Answer choice A, inadequate amniotic fluid clearance, is incorrect. This describes transient tachypnea of the newborn. It is characterized by a chest X-ray with increased perihilar markings and interlobar fluid accumulation. It typically self-resolves within 2 days. Answer choice B, infection, is incorrect. Although pneumonia can result in respiratory distress, additional signs of infection would be expected, such as temperature instability, history of maternal infection, and/or auscultatory findings consistent with pleural effusion or consolidation. Answer choice D, surfactant inactivation, is incorrect. Although meconium can inactivate surfactant and thereby result in respiratory distress, the amniotic fluid was clear in this case, decreasing the likelihood of meconium aspiration. Answer choice E, surfactant insufficiency, is incorrect. Respiratory distress syndrome results from low levels of surfactant and typically presents within hours of birth in premature newborns. This newborn was born at term gestation. In respiratory distress syndrome, the chest X-ray would typically show diffuse ground glass opacities with air bronchograms. The key learning point here: determining the etiology of newborn respiratory distress requires consideration of physical exam findings, such as vitals and auscultation, the gestation history, such as full term versus premature, and imaging findings, specifically on chest X-ray. The presence of bowel sounds in the chest is suggestive of congenital diaphragmatic hernia, which results in lung hypoplasia and respiratory distress at birth. Question 3. A 7-year-old girl presents to the emergency department with her parents immediately after having a seizure at home. Her past medical history is significant for short stature and unspecified cognitive impairment. She is otherwise healthy and has not had any recent illnesses. Physical examination is significant for a round face and contraction of her facial muscles when the angle of her jaw is tapped. Electrocardiogram shows a long QT interval, and initial laboratory tests are significant for low calcium, normal vitamin D, normal chloride, and elevated parathyroid hormone level, or PTH. Which of the following additional features is likely to be present in this individual? A, absent thymic shadow on chest X-ray. B, bowing of the lower extremities. C, elevated lipase. D, shortened metacarpals. Or E, urine pH greater than 5.5. The correct answer is D, shortened metacarpals. This patient is presenting with symptomatic hypocalcemia and likely has pseudo-hypoparathyroidism, a group of disorders defined by PTH resistance. Specifically, this patient likely has pseudo-hypoparathyroidism type 1A, also called Albright hereditary osteodystrophy, which occurs due to GNAS1 mutation, resulting in low cyclic AMP response to PTH. Laboratory tests in these patients reveal elevated PTH, hypocalcemia, and hyperphosphatemia. Physical examination reveals round facies, short stature, short metacarpals, and developmental delay, all of which are present in this patient. Answer choice A, absent thymic shadow on chest X-ray, is incorrect. This finding is present in patients with DiGeorge syndrome, an immunodeficiency resulting in thymic aplasia. Although DiGeorge syndrome can result in hypocalcemia secondary to parathyroid aplasia, this child's otherwise healthy past medical history makes this diagnosis less likely. Answer choice B, bowing of the lower extremities, is incorrect. This finding is present in rickets, which results from defective cartilage mineralization in growth plates. In children, this is often due to nutritional deficiency, resulting in low vitamin D and/or calcium levels. This patient's vitamin D level is normal. Answer choice C, elevated lipase, is incorrect. This lab finding is present in acute pancreatitis. Although acute pancreatitis can cause hypocalcemia, it most often results from gallstones, alcohol consumption, or hypertriglyceridemia, and presents with epigastric pain. This patient lacks the characteristic risk factors for acute pancreatitis to be causing her hypocalcemia. Answer choice E, urine pH greater than 5.5, is incorrect. Alkalinization of the urine can occur in distal or type 1 renal tubular acidosis, in which H+ ion excretion in the distal convoluted tubule is impaired. Although type 1 RTA can result in hypercalciuria and hypocalcemia, it is accompanied by hypokalemia and hyperchloremia. This patient's chloride levels are normal, making this diagnosis less likely. The key learning point here: pseudo-hyperparathyroidism is a hereditary cause of hypocalcemia and is characterized by concomitant short stature, developmental delay, and shortened metacarpals. Okay, so that's it for this episode, but please do check out our other episodes as well as all of our content at MedPrep2Go. If you like what we're doing,